I'm delighted to be here. I am the immediate past president of the American Medical Association, and my name is Dr. W.Gurman. Well, in the American medical system, if the doctor submits a claim to the insurance company, they're supposed to pay it. Now, sometimes there is dispute between the doctors and the insurance company, or between the hospital and the insurance company. But there are established rules about what they should pay for and what they shouldn't. Sometimes we have different interpretation about what those rules say, and we have to have a disagreement about that. But mostly, when the physicians abide by the rules and submit their claim according to those rules, then the insurance companies will usually pay for it. Well, the patients usually do not. The government will usually publish rules about certain things that they will pay for and what they won't. And the private insurance companies usually will follow what the government does. For example, if I give an injection for a problem that you have in both wrists, the government publishes a rule that it will pay for only one injection on a given date. So we know that rule, and we don't do two injections on the same date to submit to the government or to the insurer. Sometimes we do it anyway, and I know that I won't be paid for that, but sometimes we do it anyway. A different example is when I'm doing microsurgery, there is a special code for the use of an operating microscope. Now, some insurance companies will recognize that and will pay a fee, an extra fee for using the microscope. Other insurance companies won't. The government does, and the government publishes a rule that says that if I use a particular code number, that they will reimburse for it. Sometimes it's not a lot, and sometimes they don't at all. But I will say that the decision that I make whether or not to use an operating microscope is based on whether or not I need to use an operating microscope to do the best job, not on whether I get paid for it or not. Yes, we do. And it reflects the fact that in some cases, the medical care is more expensive to do in the hospital. There is a bigger infrastructure to support in the hospital. Sometimes the salaries are higher in the hospital. That's not the same in the United States. In fact, in some cases, just the opposite is happening. There are some cases where the government says, you cannot do this in a big hospital. You have to do it in an outpatient setting because it is cheaper. Now, things in the United States are changing. There was, for a while, more payment to the hospitals for things that doctors could do in a clinic or could do in the hospital, and that caused a lot of doctors to actually sell their practices to the hospital. The government is changing, and the private insurance companies are changing so that the reimbursement is now the same for a lot of these things, whether it's a hospital or a clinic, so it becomes cheaper to go to the clinic. It doesn't happen in the United States. There are situations where certain medications have to be reviewed before the insurance company approves to pay for it. So they may not pay for the medication, but they don't dispense the medicine and then make the doctor pay for it if they decide it wasn't correct. We do that review on the front end, and it's between the patient and the government or the patient and the insurance company. I'll give you an example. Statins, to cholesterol, to lower cholesterol. A drug called atorvastatin is very inexpensive and there's no review. There may be another statin that is more expensive that you may have to get the insurance company to approve why you're using that statin as opposed to atorvastatin. But they do that up front before they authorize the payment. Once they authorize the payment, then the pharmacist gets paid. If they don't authorize the payment up front, then the patient has to decide whether to take the atorvastatin or to take the other one. There's one other thing you have to remember about the United States, though, and that is the United States is one of only 2 countries in the world that have what's called direct-to-consumer advertising. So the drug company on television can put a commercial for a drug that may be more expensive. You don't have that in Korea.